India's war with COVID-19 isn't over yet, but we have got a new opponent to fight with, Mucormycosis. May 26, 2021, as of today, we have 11,717 cases positive in India throughout the country, and also 1 in 10,000 COVID patients who have got treated and returned back home. They are getting this infection within 10 to 15 days. So in this video, we will see what is this mucormycosis, what are the risk factors, what are the symptoms, what are the preventive measures, what are the treatment available, how it is diagnosed, and what is the relation between this COVID-19 and mucormycosis. Mucormycosis is a very rare disease, very rare fungal disease, but when a patient is getting infected, it could be very dangerous. These spread in the form of molds, spores which when inhaled into the respiratory system cause the infection. These are molds called the mucormycetes. These are ubiquitous, that is, they are present throughout the environment, say from the soil through the to the water to the air. There are 5 different types of mucormycosis. The first thing being the rhinocerebral, which we see in our country. Apart from it, we have pulmonary, gastrointestinal, cutaneous, and disseminated. So as I just said, it is ubiquitous. We can't avoid contact with the spores of the mucormycosis, and it is also seen that people who have a very good healthy immune system, they don't even show the symptoms. But people whose immunity is compromised, people who have a very poor immunity, for them it could be very deadly. The risk factors being patients who have diabetes or diabetes ketoacidosis, they have a higher risk of getting this mucormycosis. Also, patients who have cancer, patients who have undergone organ transplantation or stem cell transplantation, they get immunosuppressive drugs, which reduces their immune system. Also, the neutropenia, which are reduction in the number of neutrophils in our body, this reduces the immunity also. Corticosteroids are being used excessively in treatment of COVID-19, but their side effect being they suppress the immune system. Also, skin injury. The skin injury gives a pathway for the fungus spores to enter into our body. An important question: is it contagious? Does it spread from one person to another like COVID-19? No, it doesn't. So, as we move on to the symptoms, there are so many symptoms a patient can show. If you see any patient with mucormycosis, the first thing you will see is the scar, which is a black necrotic tissue which is seen in their face. Apart from that, the basic symptoms which could be seen by the patient himself is one-sided facial swelling, persistent headache, because this fungus affects the sinus cavities and the brain. The headache is seen, and the nasal or the sinus congestion, plaque lesions, fever, the sustained fever which we see, the visual disturbances because it affects the eyes and the nerves supplying it, so double vision is generally seen. Also, necrotic black lesions, red lesions, these are indicative of the necrosis which is happening behind the screen. Also, facial deformity and discoloration, droopy eyes, nasal block, and tooth loosening and jaw pain. When we move on to the prevention, there is no much we can do because we can't avoid coming in contact with the spores of the mucormycosis. One thing we can do is respiratory masks such as N95 can be used, which reduce the incidence of picking up the spores. And also, when we keep up the skin injury sites clean and diagnosis. When patients come with these symptoms, their history is taken and check the symptoms were related and correlated with the symptoms which have it in our hand. Tests and exams are also done. A part of the necrotic tissue is sent to lab for biopsy test. And finally, treatment. Antifungal drugs can be used to prevent this fungal growth. One thing, the most important thing being amphotericin drug is also used. Posaconazole, isavuconazole, these drugs are also used. Apart from this, we can finally see what is its relation with COVID-19. As I just said, 1 in 10,000 COVID patients who just recovered, they get the infection within 10 to 15 days. What is the reason behind this? There is no direct relation between the occurrence of the mucormycosis and COVID-19. It is just that the treatment we give to COVID-19 patients reduces the immunity of the immune system of the patient, and that gives the chance for these fungal spores to develop in them, prolonging the time inside the intensive care unit. Invasive oxygen therapy given to them, excess steroids. Nowadays the doctors are giving irrational use of corticosteroids to the patients, and also the self-medication the patients themselves take care of. Risk factors or occurrence of mucormycosis. So in this video we just saw about what are mucormycosis, what is the occurrence, how does it spread from, how do we get it, what is the treatment, what is the diagnosis, what are the preventive measures, and what is the relation with COVID-19. So thank you.